Good evening, everyone. Welcome to Back to Basics. My name is Dr. Vivian Asamoah. I'm a gastroenterologist in Katy and a functional medicine provider. Thank you guys for joining me tonight. I missed last week. We had some technical difficulties and we were not all able to log on at the same time. Our last week's discussion was going to be about therapeutic food plans. The discussion has been recorded and I can't wait to share it with you guys tomorrow. So please look out on Natural Gut Relief. We are releasing that video between myself and Nicole, our registered dietitian, and we think it provides a wealth of information. So I really feel like I've been off for a while. I've missed you guys. My name is Vivian Asamoah. I'm a gastroenterologist in Katy, and my passion really is a functional gastroenterology to try and help patients really, and just any individual with chronic gut illness, chronic liver disease, really understand the root cause of why they're having symptoms or issues, and really develop a great relationship with food again by getting to the root cause of their issues. So my practice is a little bit different, and I think I've always had the vision, even after fellowship and medical school training. I've always been the kind of provider who wants to get all the way and really figure things out. And I have a patient today who was like, Dr. B, why are you sending me to this other doctor? And I don't know where. I mean, I send patients to the Mayo Clinic. I'll send them back to Johns Hopkins. If I feel there's a provider there who really understands their disease and can really connect and help the patient. So experts are all over. And now it's a global world. You know, you can get expertise from wherever. So that is one thing I try and do for all patients. But the second thing I think is really a passion, is educating people to understand. You don't need to go to med school to just get information, right? There's a lot of stuff online you can read, but sometimes there's so much information, guys, that you get lost. You don't know sort of what to focus on, what is real, what is not real. Was it said by a medical provider or someone else? And so I love sharing that information and being able to at least provide, well-informed, evidence-based medicine so you understand the choices that you're making and the decisions you make. So if you guys are out there, give me a sign. I feel alone right now. The whole practice is everyone has gone home. I was kind of, they said, Dr. V, we're going to watch you later at home, so get on there live. So give me a shout out, put in some likes, put in some comments, throw in some questions. Let me know you're on there. And I'd be happy to answer any questions that you have for me today. So we are going to be talking about the gut-brain axis. If there are friends who are interested in this, please, it's not too late. Let them join us live, bring them in, share the link so they can come on in. The gut-brain axis is really important. This month is IBS Awareness Month, right? And so we've been talking about IBS. We've been talking about what it is, the different types, what type of foods. Thank you, sir. Thanks, Edward. What type of foods can help patients? What type of therapeutic food plans? And I don't want to give you guys too much information on that because Nicole, our dietitian, did a fantastic interview and you guys can watch that live tomorrow. But what I want to focus on is the connection between the brain and the gut and what science is showing us right now. So, I always go do my research. I don't want to just be talking offhand. So my physician assistant, my wonderful physician assistant, Donna, knows I spend hours, I do the research, I get the information, she researches for me because we want to present evidence-based medicine. Now, what I can say, what I have learned, which is really important, is that there's a lot of ongoing clinical research in terms of how the gut affects the brain and vice versa. There's a lot of information now that the neurologists are interested in because we're seeing a lot of neurodegenerative disease. That's like multiple sclerosis, ALS, that can maybe be reversed by a better gut microbiome, but we know that is definitely affected by a poor gut microbiome. So just to give you an example of how interesting this is, so when they take the stool of patients with Parkinson, and they assess the microbiome and compare it to the stool of healthy patients, totally different. And what they're seeing is consistency in the type of microbiome species, the type of bacteria that's in the stool of patients who have neurological issues like neurodegenerative disorders, Parkinson's, Alzheimer's, dementia, we're seeing different type of stool. And this is so interesting because if you guys remember one of my gut over it series where I was talking about halitosis, which is bad breath, there is actually an Irish nurse who has some kind of special gift. It's an olfactory gift where she can smell someone's breath and find out whether they're actually having early onset Parkinson's, Alzheimer's, etc. And so in doing this, she's like really well known all over the world. She's been able to replicate this several times. She is involved in scientific trials, so please look her up. But this makes a lot of sense as I was doing my research because I actually learned that there are certain metabolites, certain elements that are released, peptides that are released by bad bacteria in the gut that actually directly affect the brain, right? And so that bad metabolite is that release and that breakdown is what I think she's smelling in the gut. It's actually those distinct particles. So I'll break it down a little bit more because this is fascinating. This is fascinating, guys. So I'm gonna go with my notes. So there is a bi-directional relationship between the brain and the gut. They talk, there's a crosstalk. And the main reason for that crosstalk, the main mechanism is because of a nerve called the vagus nerve. And the vagus nerve from the brain innervates a lot of the organs in the body, but especially the organs in the abdomen and especially the gut. So that long vagus nerve 10 innervates the entire gut system, right? And the gut system itself has tons of neurons and receptors. We actually call it the second brain of the body. It's the gut. The gut is the second brain. And so there are all these like enteric nerves, receptors within the gut that respond to this vagus nerve. So there are neurotransmitters like serotonin that latches onto those receptors in the gut and affect the movement, that affect the motility, the way the microbiomes move, the way things are released in the gut, and really, to the core of it, affect the immune system of the gut. And this is where we think that that connection happens. So we very often talk about the enteric, immune, endocrine system, and that's the core of that connection. So imagine from enteric to the gut receptors, affecting the immune system, releasing cytokines, right? That are then bidirectional, pass the other way, and endocrine, releasing peptides and maybe hormones that are also released, and it's bidirectional, right? That go back and cause effect in the brain. So it's super interesting. And when we talk about irritable bowel syndrome in fellowship, we kind of remember, it's going to be that 30, 40-year-old female, type A personality, super anxious, and has gut symptoms, has diarrhea, constipation, or whatever. And conventional doctors always made it seem as though these people were having issues because of anxiety. But what are we learning now? We're actually learning that a lot of the anxiety that people are experiencing could be a result of the gut-brain microbiome, right? Am I anxious because I've got gut issues? As they say, it's not me, it's my gut, right? Am I anxious because I have gut issues, right? Or is it really because my gut issues are causing the anxiety? I think it's a complete loop. I think one feeds on the other. But I think when we're talking to patients with IBS, irritable bowel syndrome, or any kind of functional bowel disorder, we got to be careful not to judge, right? Because the anxiety could be made worse by the gut issues. And of course, treating the anxiety is important, but it's not the only thing, right? And so for a lot of people with IBS, conventional medicine will prescribe prescription low-dose antidepressants called antitricyclics, or serotonin receptor agonist, to help reduce the symptoms. It is helping, it is indeed, because those receptors are kind of replicating what that nerve does when it hits the gut, right? But are we fixing the root cause, or are we just masking it with neurotransmitter medications like Prozac and low-dose Celexa, instead of really addressing the root cause? Again, this love and passion for functional gastroenterology, because we're trying to actually fix the gut microbiome so the right receptors are released, the right receptors are identified, the right neurotransmitters are released, right? And you don't have to give anyone Celexa, Prozac, or whatever. But this even goes deeper, right? Because we know that with chronic stress, you can develop a lot of anxiety, brain-related issues, then that affects the gut. But what our neuropsychiatrists are seeing is that, they're now questioning because of a lot of the animal studies we have. We have a lot of mice studies that are showing us a lot of things. We have not been able to replicate everything in human studies. But in mice studies, they're able to make mice have an anxiety and depression. I don't know how they do it. I think they there's certain mutations. Something happens. I have to look back at the data, but they could have a batch of mice with anxiety, a batch of mice without anxiety, feed them differently, change their gut microbiome, and at the outcome, after several weeks, they will get that batch that was anxious now become happy and calm mice with the right food. And those that did not get that right food were eating processed and bad stuff, stay anxious. Super interesting. We haven't been able to replicate this in clinical data all the way with humans. However, because of what we're seeing, there's now a big question mark as to whether anxiety, depression, neuropsychiatric issues like bipolar disorder, schizophrenia, can that be reversed by fixing the gut microbiome or having a healthier microbiome? I think this next decade in medicine is going to be absolutely revolutionary. Because if we can actually fix the gut microbiome, we can reverse schizophrenia or actually manage schizophrenia through essentially diet, nutrition. And we'll talk about this in a lot more detail rather than going first for the medications, which we always, and I'm sure you guys will agree, and if you do agree, say a whoop whoop, but which we always come to limitations with, We've tried so many different antidepressant medications, right? People are constantly changing, adding some on. Some are causing more side effects. Some are leading to suicide and depression, right? If we could focus more on the digestive tract and helping that gut immune restoration, may we provide better solutions for our patients with mental disease? That's a huge question. Now, we can't fix everything just by saying, oh, eat this food and you'll be great. I don't think we're there yet. But maybe it will limit the dose. It will limit the quantity. It will improve response in a longer term, more long term, right? So that's really interesting. So let's go back to mechanism. I'm getting carried away, guys. We talked about the mechanism, the vagus nerve going to the rest of the body. We talked about this neuroenteric immune endocrine system, right? So the key word here is immune. Because when the immune system is triggered, and the gut has one of the biggest immune system, we actually think that 70% of our immune system, when we talk about immune, we talk about how we react to cells, how we defend our body, our host and repair mechanisms. 70% of that is in the gut. So when there's an issue with the connection and the immune system is stimulated, there's a release of cytokines. And these are basically immune mediators that cause inflammation in the rest of the body. So this release goes back through the vagus nerve, into the bloodstream, to the brain, and causes what? Inflammation in the brain, right? So multiple sclerosis has been associated with gut microbiome issues. Alzheimer's dementia, we mentioned. Autism is another one that's getting a lot of play in our clinical scenario right now, because there must be a connection. There's a genetic component, but there's a switch on factor. Like we say in functional medicine, you know what? This person may carry the gun, right? Carry the genetics, a loaded gun, but it's something environmental that pulls that trigger for disease to then happen, right? So you may have the genetics, that's your loaded gun, and then you're hit by a virus like COVID, right? We talked about long haul COVID. You're hit by the wrong microbe, the wrong diet. You're eating processed foods, carbohydrates, horrible fats, right? Saturated fats. You're eating the wrong type of foods, or it could be a toxic environment, a fungal, mold, cadmium, so metal, toxic, heavy metals, implants, those are all toxins. And it could be one of those factors that now just pulls that trigger. And then disease occurs, right? So if you guys are you're feeling this and you kind of see where I'm going with this, please put in a whoop whoop, because this is exciting information that could revolutionize healthcare. And that's what we're trying to do in functional medicine. We are actually trying to revolutionize healthcare. And if you're with a good functional medicine doctor, very often, I mean, these guys, and I'm sort of baby functional medicine, but if you're with an experienced functional medicine doc, and they can be an MD, an ND, a chiropractor, but someone who's been doing this for a long time, they are some of the most brilliant minds you will ever meet because they are going to a cellular level and not just a pharmaceutical level, if you know what I mean. They're not just staying pharmaceutical with just prescribing, but they are keeping up with the data, right? And so I got a lot of my gut-brain axis information, not from blogs and stuff like that, but I went and actually looked at what microbiome institutes around the world, and one of the biggest one is actually in Europe, what they are doing in their labs, in the mice studies, to really come out with proper data about how we should be managing our patients better. And if it's connected to the gut, brain and gut, that affects gastroenterologists, which means, this connection of working with other providers. We've talked about the GI doctor working with the rheumatologist because autoimmune disease like Crohn's, yes, affects the gut, affects the joints. But now the gut doctor needs to work with the neurologist because we need to figure out, why is this patient anxious or depressed? Yes, they have situational issues, but why is this not resolving? We need to, the neuro doctor has to actually start asking questions about, what are you eating? How were you raised? Were you breastfed? Did you get breast milk? Were you bottle fed? Did you get a C-section? Did you get, was it a vaginal birth? At the end of the day, Edward, you're absolutely right. Nutrition is key. And so we're paying on insurance every month. And we're paying these super high premiums. Trust me, guys, I'm a provider, but I complain just as much as you guys when my premium for my family is I'm like, God, I got to work a second job to be able to pay this premium, truly, right? But we're paying a lot of this, but at the end of the day, we're paying these insurance companies to help take care of us when the damage is already set, when the disease is already in. Right? And I think right now, if you're on here and you're a member of Natural Gut Relief, I think you guys all understand how important prevention is. Taking this way back down to your grandchild, teaching them from now how important it is to eat healthy, avoid the processed foods, avoid the colorants, the additives, organic, grass-fed, know which farmer you're getting your food from. We got to go back not only to finding root cause, but root eating, right? From the ground up, right? And Sherry, yes, the nursing home and retirement homes are probably contributing some. The medications we also give to patients, Sherry's comment was the poor diets in nursing homes and retirement homes may be leading to dementia and Alzheimer's. Why is it that when you put your loved one in a nursing home, they decline a lot faster than when they're kept at home with the family support? We know some of it is because there's family support, they're continuing their activities of daily living. But it's possible that a big component is diet and nutrition, where they were in a place where people were cooking together. That's not happening anymore. So it really depends, right? It really depends. So there are a lot of questions coming in that I love. Is the Mediterranean diet good for the gut? Absolutely, absolutely. And this is what we're trying to figure out. What is the best diet for the gut? And if you guys stay tuned tomorrow, Nicole has some wonderful information to share about customizing and personalizing diets that are right for you. Because if you have diabetes and high blood pressure, what you need may be different to someone who has functional bowel disorder, candida overgrowth, and something else, right? Or if someone suffers from anxiety, we may now start talking about maybe they need a different kind of diet. And we'll talk about sort of what we've discovered so far in the research. Absolutely. Alzheimer's is diabetes 3. Absolutely. So we talked about the receptors like serotonin, GABA, DOPA, right, between the brain and gut. We talked about the mechanism of injury to the brain, the immune toxins, the metabolites released by bad bacteria go into the brain, cause inflammation, cause degeneration, cause issues, right? We talked about that. We talked about, there are a few clinical studies with anxiety and depression, a few with schizophrenia, but not a lot. So it's really hard to translate this into research. But you guys all have made some great suggestions about diet and eating healthy, right? We want that spectrum of a rainbow diet. We don't want to over restrict, We don't want to over eliminate if we don't have to, but it's your source. Where are you getting this fruit from? Are you reading the labels? Are you making sure you're reading ingredients, making sure there are no colorants or, extra fake things, chemical names? If you can't pronounce the name of something on your ingredient list, it's probably not the right thing for you. But let's see where science is going with this. And let's see where the evidence-based science is going with this, right? Couple studies in patients with irritable bowel syndrome. And they've looked at probiotics, right? And we're not really sure if probiotics, a lot of patients, probiotics will help with bloating, but we're not sure if probiotics help the long-term outcome of functional bowel disorders, right? Does it really make a difference? Or does it play into when patients have bacterial overgrowth, which is sort of one type of a cause of IBS. It's one of the causes of irritable bowel syndrome, right? So probiotics have a role, but you know what the scientists are saying right now? What we're learning is that, you can't lump all probiotics into one. We are very far from the place of figuring out which probiotic works for which pathology. The scientists are really trying to target and see, is it Lactobacilli rhamnosus strain 0157 or whatever that helps with anxiety, or is it something else? But the human body it's complex. This is one of God's creations, right? Extremely complex. It's supernatural in many ways. And I think there's a huge complexity in even the interplay and crosstalk between different microbiome species in the gut, be it virus, fungal, or bacteria, right? So it could be that you need a sprinkle of Lactobacillus rhamnosus. You may need a sprinkle of a different kind of lactobacilli to really develop that right milieu, that right environment, that right fertile ground. But the scientists, of course, are trying to dig into detail. So now they're looking at specific strains that do specific things. And whenever they try and translate the animal study with those strains to human study, we don't get the same results. And again, I think that's because it's more complex. And sometimes we just have to let food be the medicine, but it's hard to do research with just food. It's really hard. And so probiotics come, so now they start talking about psychobiotics. That's the new word, psychobiotics. So these are things that affect your immune system, but affect your brain, that affect the psyche. So that's the new word on the street right now, is psychobiotics. And psychobiotics are falling into several categories. They include prebiotics that we've done studies with, probiotic, postbiotic, fermented foods, all of this to release specific elements called short chain fatty acids, right? Typically released in the colon when you have, released by colonic bacteria when you have a good microbiome. Short chain fatty acids are extremely important for the functioning of the whole body. They reduce inflammation. That's their goal. That's their job, right? But they come from what? They come from the microbiome, and they come from a healthy microbiome. So whenever someone has SIBO and we check them, their stool for short chain fatty acids, we don't find enough. So we got to replete, right? We got to replete. And so what they're trying to do is figure out what organisms are creating a lot of these short chain fatty acids, which then go to feed the brain and provide the right nutrients for the brain cells to work very well, right? And so that's what they're trying to figure out. And so probiotics, postbiotic, fermented foods, we know extremely good. So they've done animal studies with fermented foods, and we see reversal in neuropsychiatric disorders. So actually really, really interesting. So that's a lot of what I found. There's a lot of research coming out. This bidirectional relationship is extremely important. But take-home message for me as a functional gastroenterologist is, don't judge a book by its cover, because the patient's anxiety, depression issues could be from a poor gut microbiome leading to nutrient deficiencies. They don't have enough vitamin B. B12 will cause anxiety and depression, right? They're releasing a lot of immune cytotoxins to the brain, causing brain fog, anxiety, and depression. So this is making things worse, right? But then, of course, when you look at all the studies we have in human studies, right, and you look at irritable bowel syndrome, and they're trying to find resolution, where do patients do the best? not necessarily with prescription low-dose oral antidepressants, but we get the best results. And sometimes we even say 70% more effective than placebo with things like yoga, meditation, cognitive behavioral therapy, right? There's a lot of that going on right now. Gut hypnotherapy, right? People who are becoming more spiritual, prayerful. They've actually done long-term studies on patients with IBS or functional bowel disorders who then practice acupuncture for meditation, for stress, meditation, again, yoga, gut hypnotherapy, and, spiritual, prayerful, Reiki. And they've actually seen that all of that helps reduce the gut symptoms long-term without side effects. And that's amazing. And if we can't do that, if we can do that, isn't that the best option, right? At the end of the day, our goal is to do less harm as providers. So guys, I said it was going to be short today. It's already 25 minutes. I guess I missed you all too much. Thanks for being part of the Natural Gut Relief Facebook group. I hope you guys found this interesting. Stay tuned tomorrow for our discussion with Nicole Harris. A lot of great information about Mediterranean diet, Candida diet, low FODMAP diet, and what is therapeutically best for you and what you can do long term. And if you love this, oh, Riza, so nice to see you. We miss you, Riza. If you love this and you enjoyed it, please leave a whoop whoop and go ahead and share this with people. So now, y'all, my whole team, my medical team, remember, Rose, you guys are doing a great job. I thank you for all your hard work. Amanda, my virtual team out there, Miss Liz, y'all are doing a great job. I know our practice is growing and changing, but we're going to make it bigger and better. May is allergy month, food allergy month. We promised everyone we would be going gluten-free for the whole month of May. I have some wonderful topics and interviews for May. I have been lining up my May Thursdays. I got an interview with an allergist friend from National Jewish. She's a conventional allergist, going to be talking about food allergy testing. I got an interview with an allergy company, that company that does allergy food sensitivity testing. And I want us to probe them with some hard questions about why is your test so expensive and what does it mean for me? We're going to be talking to some supplement companies, some doctors from supplement companies, talking about what are the best allergy botanicals, like botanicals for allergies, like supplements like quercetin, turmeric, what dose, what has been studied. So I've got every Thursday on Back to Basics lined up for Facebook Live Q&As for the month of May. It's going to be our allergy series, and it's going to be whoop, whoop. Have a wonderful evening, guys. Dr. Vivian Asamoah, Back to Basics. Bye-bye.